Hello and welcome to Citycast. I'm Rishika Kashyap.
And I am Vinaya K.
We start with the aftermath of the 2 waves of COVID on the health workers in the city. COVID frontline workers have developed mental health issues due to the stress of work during the pandemic. Our reporter Vinaya K brings us the story.
A study done by the Department of Community Medicine, Sri Devaraj Aras Academy of Higher Education shows half of the medical staff in Karnataka suffer corona anxiety and other mental illnesses which manifest in their behavioral pattern.
Working time is more. Continuously working more in clinic, you getting like psychosis, irritation. Health is not good. The doctors also be human being.
Mental health care goes easily unnoticed in India. Increased stress and anxiety impacts the overall well-being of an individual.
Definitely it's had an impact, stress levels and workload for the doctors in the pandemic. Wellness sessions are needed to kind of de-stress and to recuperate.
The Karnataka Mental Health Program doesn't include any particular schemes aimed for medical staff or frontline workers.
Workers, including the medical community, went through a lot psychologically speaking. It would have been good if there was little more health infrastructure.
Experts believe that there is a need to sensitize the public and the government towards the mental health issues faced by healthcare professionals. This is Vinaya reporting for Citycast. The percentage of married women facing domestic violence has doubled in the last 4 years in Karnataka. Our reporter Rishabh Rai talks more about it.
Data from the National Family Health Survey shows domestic violence against married women has increased from 20.6 to 44.4% in the last 4 years. A victim's mother, who was unable to make a complaint, tells us what her daughter went through. NGOs say many women hesitate to raise their voice against the atrocities they face. Irrespective of the severity of the case, such cases are significant in number.
In number of cases, one is they are brutally been hit. Maybe they are been manged. They are come with a bruise and this their eyes swollen, blood oozing. If I was getting daily 1 or 2 cases, now I may get 5 to 6 cases.
Population is grown, that way problems also increase. And a lot of violences, physical, mental, sexual, emotional, financial and all is going on.
The number of cases surged throughout the COVID lockdown, putting stress on married life and degrading the environment children had to face at home. The experts say a lot depends on how the victim reacts to the situation, and that voicing their issues is the only way forward.
When some problem happens, so they have to come out with the complaint.
NGOs say that close to 50% of the cases go unreported. Most of the cases conclude with out-of-court settlements. This is Rishabh Rai reporting for Citycast.
Fewer pregnant women in Bangalore are applying for the Janani Suraksha Yojana. Our reporter Shreyashi Mukherjee tells us more about the story.
Many pregnant women who could benefit from the scheme do not apply for it because they are unaware of it and the documents required for the scheme. Beneficiaries say that they have to spend from their own pockets for institutional deliveries.
मेरे पास आधार कार्ड, बीपीएल कार्ड, बैंक अकाउंट है. मेरे को डिलीवरी होगा के 4 months हो गया. जननी सुरक्षा योजना पता नहीं मेरे को.
Poor pregnant women are entitled to free institutional delivery along with an amount of ₹600. The poor women otherwise have to pay ₹12,000, which becomes a monetary burden for them.
ಹುಟ್ಟಿದ್ದು ಏಪ್ರಿಲ್ 24. ನಂದು ರೇಷನ್ ಕಾರ್ಡು ಇಲ್ಲ, ಬಿಪಿಎಲ್ ಕಾರ್ಡು ಇಲ್ಲ. ಆಮೇಲೆ ನಮಗೆ ಜನನಿ ಸ್ಕೀಮ್ ಬಗ್ಗೆ ಯಾರು ಮಾಹಿತಿನೇ ನೀಡಿಲ್ಲ.
A report from the Ministry of Health and Family Welfare shows that there has been an increase in the maternal mortality rate and infant mortality rate by approximately 2%.
Yojana is very good, but still people are not registering themselves for this Yojana.
Most of the women do not have proper official documents like Aadhaar card, PAN card, BPL card and bank account in their names. Dr. Shruti Shetty says that it is important to educate the poor population about the various schemes launched by the government.
In urban areas, we're not aware of where we have to go to get the documents done, what documents are required, what schemes are actually available. Only majority of us in the urban area especially is not aware.
Since majority of the women do not come under this scheme, deliveries become an expensive affair for them as they have to pay from their own pockets. This is Shreyashi Mukherjee reporting for Citycast.
See you after a short break. On the other side, we will tell you if home food businesses are safe despite their popularity.
Welcome back to the Citycast. We'll start with how the lockdown saw many food enthusiasts open up their own food businesses. However, most of them are not registered under the Food Safety and Standard Authority of India. Our reporter Shiporna Roy brings us the story.
Officials at the Food Safety Commission have received about 20,000 registrations in the past year. However, they are aware that many businesses are operating without registration. According to the food safety regulations, food businesses should follow proper protocol like wearing gloves and hairnets. However, most of the businesses don't follow these rules.
Honestly, I've never given this a thought. It reminds me of my food at home. Simple and delicious. It's very cost effective and made from fresh produce.
Most kitchen owners say they are unaware of the registration. More established owners say every food business should be registered.
I've always believed in one accountability. If you're selling food right, you have to be accountable for whatever you're doing, whatever actions you have taken. So tomorrow if some food poisoning happens, you can't just wash your hands saying I'm a home chef or I'm a home baker, I'm not accountable.
Businesses can be fined up to Rs 5 lakh if they're not following the laws. Food aggregators say there is a lot of misinformation about the licensing process. Citing hygiene to be the most important criteria, the board will be starting more awareness programs, but they do emphasize that it isn't legal to run a food business without a registration. This is Shiporna Roy reporting for Citycast.
Banerghata Biological Park receives more donations this year. This helps the park maintain the level of care for all the inmates. Our reporter Shubhanki Mishra tells us more about it.
There is 124% increase in donation to the Banerghata Park this financial year. One-day feeding option and Mrugla Ramadana received donation from 229 donators in the 8 months after launch. This has helped mitigate the loss because of low entry ticket sales.
Last year we had a collection of only 55 lakhs, and this year, even though the only 6 months, we have a collection of 2.3 crores.
In addition to the donations, the park authorities came up with several cash-saving schemes to help them maintain their status as a self-sustaining park. All animal keepers were involved in fodder harvesting, saving Rs 36,50,000. One-day feeding option collected approximately more than 10 lakh donation. Care standard of animals remained unchanged.
Tiger cost yearly 5 lakhs, for around 5 lakhs. The adaptation only 1 lakh. 1 lakh for adaptation per year. That type only we can procure more 3 to 4 crore rupees from adaptation.
Banerghata Biological Park is planning to reach out government schools all across Karnataka for educating students through posted and award-winning quiz competition regarding animals' welfare. This is Shubhangi Mishra reporting for Citycast.
BBMP's temporary teachers face difficulties with delayed salaries. Our reporter Shubham Chauhan tells us more about the story.
For Divya Gopal, who's one of the 600 temporary teachers out of a total staff of 800 in BBMP schools and colleges, the profession is her passion. This, however, comes at a cost.
Actually, salary it will be every month will not getting on time. August month salary is till now we didn't receive.
Divya is part of the 18 temporary teachers at the BBMP Composite PU College. While 8 others are permanent, the salary issue seems to be only for the temporary staff.
The commitments are there in our life. Like EMI is also there. It will deduct from our salary itself. We are completely depending on the salary.
Meanwhile, temporary teachers at the Magdi Road High School explain that getting salary on time means that it comes with a month's delay, adding that the situation has improved since the last 3 months.
Before it was not on a time, but from last 3 months in time we are getting. 1 month will be hold and 1 month salary we will be getting.
Interestingly, the school just has 1 permanent teacher out of 13. The rest are on a temporary basis. Experts say that salary delays for temporary staff is a pan-India problem and that the fault lies in the system.
It is a very systemic problem. Structural problem, it needs structural solution, which is that the government has to really think about the teacher. They have to feel for them. As long as they feel for them, then there is a possibility that it can be solved.
The BBMP plans to hire more permanent staff in the coming years. As for the existing temporary staff, an assessment will be carried out based on which the suitable ones will be taken as permanent.
In the next coming years, we are planning to recruit 250 primary and high school teachers so that we give job security to everyone.
The BBMP temporary teachers are facing all sorts of problems thanks to delayed salaries compared to their permanent counterparts, but continue to do their job regardless. This is Shubham Chauhan reporting for Citycast.
It's time for a short break. The other side, you will see how cyclists in the city are worried about their safety.
Welcome back to Citycast. Cyclists are worried about their safety, although cycling is a healthy and sustainable mode of transport. Our reporter Subhashri Mohapatra tells us more about the story.
The Bangalore Traffic Management Center says for every 4 cycle accidents in the city, one of them loses their life. The fatality spikes safety concerns among the commuters.
Sometimes a biker or a car just suddenly passes by you really fast. That actually can be quite frightening. There are no cycle lanes in this part of the city where I live.
Directorate of Land Transportation introduced programs like public bicycle sharing in September 2021. BBMP collaborated with Bangalore Smart City Limited to introduce 36 smart lanes with cycle paths by 2020, but the projects are still incomplete. Cycle enthusiasts organize campaigns that encourage safety of cyclists by adding helmets, safety belt, and curved cycle handle ends. But the lack of cycle infrastructure is bringing them down.
We have a lot of change makers in the mix, and they, along with me, are trying to change the way cities move. The pedestrians and the cyclists need to be kept safe by motor vehicles.
Cycle lanes in many countries have proved that cycling with safety can be a modern way of transport. This is Subhashri reporting for Citycast.
Even after paying fines and penalties, auto rickshaw drivers avoid using meters and continue to charge more. Our reporter Saili Patil brings us more.
Rickshaw drivers are demanding excess fares and the commuters are facing problems as they have to go through the tantrums the drivers throw at them for refusing to pay more.
Extra charge ಕೇಳ್ತಾರೆ ಅಕಸ್ಮಾತ್ ಎಕ್ಸ್ಟ್ರಾ ಚಾರ್ಜ್ ಕೊಡಲಿಲ್ಲ ಅಂತಂದ್ರೆ ಎಷ್ಟು ಕೇಳ್ತಾರೆ ಅಷ್ಟೇ ಕೊಡ್ತೀವಿ ಇಲ್ಲ ಅಂದ್ರೆ ಎಕ್ಸ್ಟ್ರಾ ಚಾರ್ಜ್ ಬೇಕೇ ಬೇಕು ಅಂತ ಬಲವಂತವಾಗಿ ಕೇಳಿದ್ರೆ ಕೊಡಲೇಬೇಕಾಗುತ್ತೆ.
In the last 3 years, more than 35,000 cases have been booked against rickshaw drivers for demanding excess fare. This year has more than 525 cases booked. Commuters say they do not complain against these auto drivers.
We have not tried complaining about it. It's because people don't want to waste time on all these things, that is why.
The drivers say that they have been hard hit by the COVID pandemic, but the Auto Drivers Union agrees that the drivers charging excess amount is not fair.
गवर्नमेंट लाइसेंस देने का टाइम में पूरा ट्रेनिंग देखो, लाइसेंस देने का टाइम बोलना पैसेंजर लोग का ये कैसा बात करना.
Experts says that such problems are mostly faced by outsiders and they should immediately register a complaint.
The vehicle will be seized and the driver will be punished, or it situation warrants, it will be taken, it will be booked for the case also, and it goes behind the bar also. It is.
A senior officer at traffic department requests the passengers to come forward and complain. He says that people should not suffer silently as it encourages the drivers to demand more fare. This is Saili Patil reporting for Citycast.
That's all for today. See you next week with new stories.
For more updates, visit Citycast website. Thank you for watching.